So, you're about to start your respiratory placement and you want some top tips for how to succeed. Well, that's what we're here for. Let's dive in. Hey guys, Khalid here. Welcome back to Clinical Physio. So top tip number 1, contact the place you'll be working to find out what it's all about. And that's because respiratory can be so different based on where you're working. For example, you could be working on a medical assessment unit, which is incredibly fast-paced, loads of turnover, or you could be working on a surgical ward where you're seeing post-operative patients. You could be working on an acute respiratory ward, seeing COPD exacerbations or pneumonia patients, or you could be working on the intensive care unit where you will be seeing everything. So it's a really good idea to get in contact with your placement supervisor before you get started to introduce yourself, to find out what it's all about and ask some simple questions such as, what are the key conditions that you see day to day? What are the key treatments that I need to be aware of that you use all the time? This can really get you off to a good start. Top tip number 2, assessment. Now, this could be talking about your subjective assessment, your objective assessment. Maybe you follow the A to E assessment pathway. Whatever it might be, we've got some links in the description below for tutorials that we've done on each of these, so check those out below. And the key thing to think about here is that knowing what questions you want to ask as a part of your subjective assessment and knowing what you're going to look at objectively before you go and see the patient is vitally crucial. It means that you can actually reserve brain power for thinking what your patient is actually presenting like, the problem that they might have, rather than thinking to yourself, what am I supposed to do next? So that's super important. To also give you more confidence, the basic principles for each respiratory patient is the same, whether you're working in the community, on an acute ward, or on the intensive care unit. So take faith in the fact that what you learn will be useful to you. Top tip number 3. What is your patient's main respiratory problem? Now, if you're not familiar with this, we often teach that you can break down almost every respiratory patient you have into having one of 3 main problems. That is either going to be increased sputum retention, volume loss, or increased work of breathing. And effectively, if you can work out which of those 3 is your patient's main issue, you can then plan your treatment around it. So for example, if it's to do with sputum retention, right, we need to get the sputum up. Therefore, am I thinking suctioning? Am I thinking ACBT? Am I thinking mobilization? Is it to do with work of breathing? It might be that, for example, you've got a patient with exacerbation of COPD who's really struggling with their breathing. Okay, do we have to think about NIV for this patient? Or it could be to do with volume loss, and you might be thinking, right, what are my options there? ACBT, thinking about breathing exercises. So hopefully this gives you an idea. If you can work out what the problem is, it can direct you to a treatment strategy. Top tip number 4, and this one might be a little bit biased. Check out Clinical Physio membership. We've got so many resources that can really help you with your placement. That could be webinar tutorials. We've got loads of these: respiratory assessments, respiratory treatments, chest x-rays, ABGs, you name it, we've got it. We've also got podcasts and a whole host of written resources on different conditions which tell you what are the key signs and symptoms, what are the key ways in which we assess and treat these patients. All of this can be really useful and can be accessed on the website or in the palm of your hand on the Clinical Physio app. Top tip number 5, and this is crucially important for respiratory physio in particular: get stuck in, take every opportunity. What do we mean by this? Well, there's nothing quite like being able to do things for real with a real patient in front of you when it comes to respiratory. It's great practicing things at university, but it's so different when you've got to do it for real. So that might be looking at chest x-rays. If your patient's had a chest x-ray, take the time to talk it through with your supervisor. Try and correlate it to your patient's condition. Same with an arterial blood gas. Work out exactly what's going on and why because of the patient in front of you. And hey, things like suctioning. This is definitely something that I remember practicing at university, but it's totally different when you've got a real patient in front of you. It might seem daunting, but it's the best way to learn. So there's nothing like the real thing. Get stuck in. Top tip number 6, get involved with the MDT. The multidisciplinary team. It's a huge factor in respiratory working because everyone has a really important role in caring for that patient, and therefore it's really important that we get used to working with those individuals as well. So when you get to the ward, when you get to your place of work, say hello and introduce yourself to members of the team. Get to know what they do, because it might well be that you need to work with them at some point during your placement. And then don't be afraid to get stuck into different MDT activities, whether it be a board round or a ward round where you're discussing all the different patients. Maybe you could be the respiratory physio voice for that particular board round. It could be a case conference with a member of the family for the patient who's about to be discharged, and you're talking through the discharge planning. It could be doing assessments with the occupational therapist so you can work out together what kind of things that patient needs to have in place for when they go home. So get involved with the MDT. Top tip number 7. Verbalize your reasoning with your supervisor. So whenever I've supervised students in the past, it's always been difficult to try and work out just how much that person knows, just how much they've gained from the placement until they actually tell me, until we actually have a conversation about a patient and I hear about their reasoning, or they talk me through a chest x-ray and I can see their knowledge. But if a student doesn't talk to me or doesn't verbalize their reasoning, I just don't know that piece of information. So make sure that you take the opportunity to always discuss with your supervisor about that ABG and what it means, about what you found on your assessment and why you think it's important. Maybe it's about what we said earlier, about what's the main problem, and showing your supervisor that you can work that out. It's a really fundamental part of your placement to be able to demonstrate that you really know your stuff. And finally, top tip number 8. Remember, it's not only about the lungs. Whenever we think respiratory, we think about chest patients. But of course, rehabilitation is also a crucial part of respiratory physio. Whether that be a patient on ICU who's just taking their very first steps after being in bed for a few weeks, whether it be a patient who's on the ward who's struggling to get back to their baseline, respiratory physios play a crucial role in helping patients gain strength, gain function, gain cardiovascular fitness, gain everything they need to get home or to get back to their normal life. And then that's another point. Discharge planning. We mentioned it a little bit earlier with the case conference, but it is true that physios play a really important role in helping patients to get out of hospital and back to their home environment. So whether that be working with the occupational therapist, whether it be working as part of a discharge planning session where you're trying to work out the key things that are needed to get a patient home, remember that that's a part of your role too. Loads to learn on your respiratory placement. And so, ladies and gentlemen, that's it from us. Remember, there's loads of resources that we have to help you with your placement. Links in the description below, whether that be for individual webinars or our membership, which gives you access to loads of our different resources. If you've enjoyed this video, please don't forget to smash that like button, subscribe to the channel, follow us on Instagram at Clinical Physio, and once again, if you need anything from us, just let us know. My name's Khalid. See you really soon here on Clinical Physio.